The GP scholarship program on the Central Coast is an opportunity for GPs to work with specialists in specialist areas at Central Coast Local Health District. It's a partnership we have with Central Coast Local Health District, and it covers some really interesting specialty areas. And the feedback from GPs is really positive because not only does it help in terms of skills in those specialty areas, but you develop relationships with specialists.
I think the scholarships are a really great, unique opportunity for general practitioners on the coast to, one, grow their relationships with the specialists that work in other fields other than general practice, so that when they're referring patients in, they actually get to know them a lot better. But also some of the skills, it may be skills they've had and they might need a refresher, or it might be new skills that they're learning due to the types of patients they're coming in.
The GP scholarship program is a 40-hour program. There's built-in flexibility to allow for the GPs themselves with their commitments to their own practices. So they would come in, maybe they can do 4 hours a week for 10 weeks, or alternatively we've had GPs come in and do a 40-hour week and complete the program within 1 week.
We've been having GPs spend some time with us over the last few years. We've had 7 GPs in total that have spent time with us on the GP Scholarship Placement Programme, and actually had 3 come through this year. From our perspective, the benefits of the programme are that we get to experience what it's like for GPs in their practice and their experience with palliative care, and we get to form relationships with them, and they get to know about what we do and how we as a team work. And I think just building those connections so that if there's a future problem, they know they can call us, they get upskilled in palliative care, and it just builds greater working relationships for all of us. And it's actually really quite a pleasure to have a different viewpoint and a different perspective coming to spend time with our team as well.
So by actually spending time in the environment, and it's great to be able to have that paid time, so it means you're not losing money when you're out of the practice, that real opportunity to get to know people, and you put a face to the name, and you actually get a much better feel for what types of services are provided.
When patients leave the hospital, the medical officers inside the hospital know that they're going to be well looked after by their GPs, which I suppose in turn has a positive effect on the community as a whole.
In general practice, it's a really rather unique place where you have a longitudinal scope of practice. You know, you're with the patient when they get married, and then when they have their children, and then when somebody dies, and or they get divorced and then become grandparents, and then of course at the end. So it's a nice thing to actually be able to be there as well. That's what I thought, but never had the confidence to actually be a part of that.
I think what they get to see is probably some of the more complex symptom control that we look after. They get to sort of have a bit more of a grounding in some of the patients that we're seeing in the hospital environment as well as the community, and especially our pain relief medications that we're using. They're also getting to see palliative care not just being the medical sort of side of palliative care, but the nursing role, the social work role, the occupational therapy role. They get to spend some time with our bereavement counsellor as well. So they get a bit more of a holistic idea of how the team works, rather than just focusing all on the medicine, which I think is really important for our patient population as well.
After doing the course, you have the confidence. You know what you have to do, and it's not that uncertainty, am I doing the right thing, or am I doing enough? You just know what to do. I would absolutely recommend any GP who's interested in being a part of their patients' lives in a very meaningful way, to do it. You've got nothing to lose, everything to gain.
If GPs are interested to spend some time with us, they need to approach the local PHN to be able to inquire about the programme.